Hey, this is David Drinks here at the Med Gym, and I'm here with Cade, and we're going to talk to you today a little bit about breathing and how important it is as something that we can assess and make sure that you're breathing functionally, and we're integrating good breathing into some of your basic core stability, spine mobility movements, making sure that there's no underlying breathing dysfunction that is causing potential problems in how you move and feel on a daily basis. So we tend to, from a movement perspective and a health perspective, look a lot at movement, especially in the gym and fitness setting. We look at how do you move? Do you move well? Are you stiff? Are you tight? Are you unstable? And we work on some of those problems that we perceive by stretching, by strengthening, but there may be an underlying problem that is underappreciated, which is how well are you breathing? Is your breathing functional? Is it integrating with your core stability? Is it helping you move better? Is it helping you in every activity? Or is it causing some underlying issues? So breathing is one of those things that we do thousands of times every day. If you're not breathing functionally, you may experience some symptoms that are common symptoms, but maybe underappreciate why they're happening. So some of the things that may show up if you're not breathing functionally and you're not breathing well, a lot of chronic stiffness. So breathing interacts with our nervous system, our autonomic nervous system, our fight or flight sympathetic nervous system, which is driven by short, shallow breaths or more forceful breathing, versus our parasympathetic nervous system, which is driven more by shallow, relaxed breathing, rest and digest type of nervous system. And so a lot of people are stuck in this chronically overstimulated, high stress, sympathetic nervous system throughout the day. It's feeding into some of their breathing and their movement dysfunctions. You get a lot of chronic stiffness through the upper traps, through the neck. You might even have pain in the neck, pain in the shoulders. It may show up as low back pain. It may show up as hip pain. We often see stiffness and pain underlying something as basic as breathing. The reason why I point out breathing as maybe something underappreciated is because a lot of times we jump to, let's stretch out this tight muscle. So we got maybe tight upper traps. Let's see what we can do to massage and stretch it out. But breathing is one of those things you do thousands of times every day. And if you're recruiting the wrong muscles to breathe, you may be just re-ingraining that stiffness and that movement dysfunction over and over again. So no matter how much you stretch, it's going to come back. A good example of this as well in a postural perspective is you turn to the side, Cade. A lot of times people are not only breathing up into their upper traps, so they're creating a lot of stiffness. So some of the accessory breathing muscles, if they're not diaphragmatically breathing, and so we see this rise in the shoulders, he's kind of accentuating that. We also may see a forward head posture. So some of the anterior neck muscles, scalenes, sternocleidomastoid, pec minor, pull the head into this forward head posture, and we also may see a little bit of rounding forward of the shoulders. So when people are breathing, they're starting to re-ingrain these postures that are dysfunctional and also causing a lot of times some pain at the neck, the shoulders, the upper part of the back. Breathing may be a great underlying source that we can start to work on to correct that. The other posture that we might see is just the exact opposite. So an inhalation posture where we're extending through the back and we're kind of flaring out the rib cage. So some people are more stuck in this inhalation posture, and this shows up as a real tight and stiff lower back, mid back. So these muscles are real chronically stiff. We also, a lot of times people have chronically tight hamstrings when they're in this posture. It may show up as you got tight hamstrings all the time, you're stiff in the low back. It may not just be a mobility or a stretching problem. It might actually be your breathing re-ingrains this posture. And so we want to talk about how we can use good diaphragmatic breathing to get out of this posture. I want to show you some ways that you can actually assess how you're breathing and if your breathing is optimal or if it's a little bit less than optimal, and we can work on it. Quick way that we can start to assess it is not only your posture, so looking at yourself, are you in the forward head posture, are you rounded, or are you super extended through the spine? Some of those are clues. We can also start to dig a little deeper by feeling where you're breathing. So if you take a relaxed breath, just nice and normal breath in and out, start to pay attention to where you're feeling. So what's moving? What's maybe rising, falling? If we feel a lot of rising and falling in the chest, the shoulders, the upper traps, or he's breathing and he's feeling this expansion at the chest, that's a little bit more of a dysfunctional pattern that we're using too much of these accessory breathing muscles. We're not getting good expansion around the core, so any inhales, we should have a nice easy expansion around the core. The diaphragm expands and then we contract as we exhale. Instead, we might see some hollowing out of the abdomen. So I asked him to take a little deeper inhale, and this abdomen hollows out, chest expands, and so it's a good sign that you're not breathing optimally. And so we want to take that and now say, okay, what should we be feeling when we breathe? So if you're feeling some of that, we want to focus a little bit more on expanding around the core and around the midsection. So if Cade puts his hands on his upper chest and his abdomen, long, slow inhale, prioritize breathing down here, not breathing up here. So that's one good way to assess, am I breathing more in my core? Is that expanding when I inhale and contracting when I exhale? Or am I breathing up here? The other way that he can do it is to take his hands and put them above his pelvis and actually expand out a little bit to feel the bottom of the rib cage. And so we should feel, as you take a normal inhale and exhale, that we're getting some expansion, not only at the belly, but 360 degrees around the core. So all the way around the core, we should feel some expansion. Even the low back expands a little bit and contracts as we exhale. So as he inhales, he should feel the rib cage move laterally. And then as he exhales, it should come back in and contract. So that's a proper breathing pattern. Another way to test if you're breathing well or if there may be an underlying issue with how you breathe is something called functional residual capacity test. And so this is basically a test that gives us a little glimpse into how well you can inflate your lungs and then hold your breath before you feel like you need to inhale again. People that have a little bit of breathing dysfunction, they're not going to be able to hold their breath very long in this test, versus if you're breathing optimally, you're going to be able to expand the time you can hold your breath. So to do this, we're going to get a stopwatch, and we're going to have Cade do a normal inhale and a normal exhale. So not a full inhale and exhale, but just normal breath in and out. Once he gets to the end of a normal exhale, he's going to plug his nose and he's going to start the timer. And so we're just going to start the timer, hold the breath, and as soon as he feels the need to inhale again, so he's got to let that go and inhale, that's where we stop the timer. So go ahead and just give a little demonstration. Normal exhale, he's going to plug his nose, and we're just going to count 20, 20. So we can go about 20 to 30 seconds is a good place to be. If you're beyond 30 seconds with that test, you don't have to inhale again until you get to 30. You're A+. If you're under 10 or if you're under 15, that's a good sign that there's some underlying dysfunction. So we want to make sure that we work on breathing and work on diaphragmatic breathing if that's the case. So there's some quick tests and assessments that you can do from home just to see how you're breathing right now. What do you feel when you're breathing? What do you feel on a chronic basis? Are you stiff and tight all the time? Do you have pain? Do you have some of that chronic tightness in those areas I talked about? Are you yawning chronically throughout the day? So these are some signs that your breathing might not be optimal. If you didn't score that well on the screen we just showed you, then you may want to work on your breathing. So to work on your breathing, we're going to give you a few basic exercises that can start to integrate diaphragmatic breathing into how you move, and then how you breathe on a daily basis. So we're going to show you those exercises, give you something to start with right now. So we're going to show you a basic breathing exercise we call crocodile breathing. Crocodile breathing is set up face down in the prone position, like a crocodile laying here, just taking normal inhales and exhales. And the way we use this is as a really good drill to bring awareness to where you're breathing and to work on if you have any dysfunctional breathing patterns, meaning you have too short or shallow of a breathing pattern, you breathe into your neck or your upper chest too much. And really the goal of this is to start bringing awareness and to start to correct breathing so that we can reduce stiffness in the low back and in the mid-thoracic spine. We can also just really start to work on integrating this breathing into all of our functional movements. So to set up for it, face down on the ground, palms under the forehead, so we're in a good spine position. And from here, I'm going to have Cade just do a normal inhale and exhale. And once he does that, I'm going to ask him to do a little more exaggerated and just take a full inhale and a full exhale. And I'm just putting hands, one on the upper back and one on the chest, just to assess where he's breathing. So if I see a lot of movement in the upper back, we want to encourage more movement here in the low back and in the abdomen. From his perspective, he's feeling that he's expanding into the mat, into the ground, and he's feeling some expansion at his low back. So he should get some real kind of release of tension and relaxation here at the low back. And normally we're going to do this 5 to 6 second inhales and then a little bit longer 6 to 8 second exhale, trying to really get deep diaphragmatic breathing going, relax some of the tension at the spine, and usually about 10 breaths is enough just to start relaxing and integrating good functional breathing. So we're going to go over supine 90-90 diaphragmatic breathing, and this is a great drill just to work on good diaphragmatic breathing, functional breathing, and this ties into not only core stabilization, but really relaxing hypertonicity or a lot of tension throughout the body and helping to get ready to improve movement, whether that's improving mobility, improving control of the body. And really the goal here is just bring awareness to breathing and bring awareness to where it's happening. Make sure we're using the diaphragm and not just the upper traps or the neck or the chest to breathe. So as Cade sets up here, we're going to first do a high-low breathing pattern. And so we want to make sure that we're not breathing into the chest excessively. So if you want to do one incorrectly real quick, we're going to kind of suck in the core and fill up the chest. And so there's a ton of stiffness happening up here. So that's a dysfunctional breathing pattern. Instead of that, we want to be relaxed up here. And as he inhales, we're going to see some normal rise of the abdomen and a gradual fall as he exhales. So first we're just assessing that we're not breathing up here. We're breathing more into the abdomen. Now we don't only want to be breathing in a rise and fall pattern. We actually want to be breathing 360 degrees around the core. So there should be expansion of the rib cage, expansion of the abdomen. So I'm going to have Cade set up now for hands on his sides. He's going to put hands on his lower core just above the pelvic bone. And now he can feel kind of that soft tissue above his pelvis and where it moves when you breathe. So as he breathes now, we're trying to expand out laterally, not just up and down. And so this is really a correct breathing pattern that we can use to ingrain good diaphragmatic breathing. And that impacts everything from core stability, core function, and then all the way up to how you move from a mobility and a stability perspective. So we're going to show you supine core engaged deep breathing. And in this exercise, we're really working on taking a relaxed diaphragmatic breath where we're breathing correctly. We're not breathing into the chest or tightening up some of the accessory breathing muscles up here. But more than just that relaxed inhale and exhale, we're going to start to integrate core stability from a more foundational, deeper core stability perspective. And this is really crucial to working on stability around the spine, working on some of those deeper core muscles like the transverse abdominis that really functionally stabilize your core, your pelvis, and your spine. And so we start to integrate that from a very basic level here. So the way we do this is we're going to take a long, slow inhale, and Cade's got his hands just above his pelvis. And as he exhales, he's going to push his index finger just inside of his pelvic bone. So those little pointy bones on the front of your abdomen, just inside of that. And as he does a long, slow exhale, he's going to breathe out about 6 to 8 seconds, and at the very end of that breath, he's doing a little more of a forceful contraction as he exhales. As he's digging in a little bit with his fingers, he should feel his lower core start to just press out into his fingers a little bit, so he feels some muscular engagement versus just being able to push into his abdomen. So again, nice deep inhale, we feel some 360-degree expansion, and as he exhales, he's doing a long, slow enough exhale, 6 to 8 seconds, that he feels some engagement, some pressure against his index fingers at his lower core. We're going to show you a little bit more advanced breathing exercise, and we're calling it cat-camel breathing. And so in this version, Cade's going to set up here in a suspended spine position on all fours, and we're just going to go through some extending of the spine and then some flexing of the spine, and he's going to focus on breathing. So when we extend the spine and lift the head up a little bit, that's an inhalation posture. So he's going to inhale, and then as he flexes the spine up towards the ceiling, tucks the chin, that's an exhalation posture. We're going to exhale and breathe out. So as he goes through this, he's focusing on expanding through the midsection, breathing into the core, feeling some rib cage expansion. He's not breathing up into his neck or his upper traps. So we're just going to cycle through those. Inhale. As he comes down, he flexes. We're going to exhale. And our more advanced version of this, to create a little bit more challenge, is now we're going to get to one posture. So he's going to extend. We're going to inhale and exhale. Just spend some time there. Relax breathing. Exhale. Once he cycles one breath, we're going to come up. Inhale. Exhale. And now we're just spending some time in each position working on relaxing some of these spinal muscles, integrating good diaphragmatic breathing into core and spine movement. So we're going to go over a little bit more advanced breathing drill that works on integrating diaphragmatic breathing into some mobility. And so we're going to work on not only expanding through the core as we do a good inhale and exhale and working on mobility there, but we're also going to work on some hip mobility. So we're going to do cat-camel breathing, and we're going to flex one leg up next to the hand. So Cade's going to bring one leg up just outside of his hand, and now he's in some hip flexion on the one side, hip extension on the other side, and he's going to cycle through some extension, inhale, and then as he flexes, tucks his chin, rounds the spine up towards the ceiling, a good long, slow exhale. So we want to take our time with this. Good 4 to 6 second inhale, and then a long, slow 6 to 8 second exhale. And so as we flex down, he's going to exhale. As he comes up towards the ceiling, he's inhaling. And so a little more advanced version of this is instead of just inhaling, exhaling, he's going to pause in each position and cycle one full breath. So inhale, exhale, and then go ahead and flex. Inhale, exhale. And this allows us just to get comfortable in a good mobility position here, working on diaphragmatic breathing, working on mobility from a real basic level.